Hi guys, this is David with Detox Directive. I want to talk for a minute about alcohol detoxification. In our society here in America, alcohol abuse is consistently a major health crisis. In all my years of working as a nurse in a detox unit, the entire 27 years consistently, alcohol detox was on average half of our census. Always half of our beds, which ranged anywhere from 33 beds up to a 55 bed unit at one point. But always half of our beds were utilized for alcohol detox processes. So very, very common problem, very common issue. Once a person begins to develop physical dependency to alcohol, that's the point where a medical detox process is indicated. And when I say physical dependence, that is usually shows up in symptoms such as, typically anxiety is probably the biggest symptom. Anxiety, nervousness, sweats, tremors are very common symptoms. And if you're in that place where your drinking has become so regular that when you begin to experience those withdrawal symptoms, if you have a drink or two, regardless of what you drink, and those symptoms go away, and you then feel normal, you are probably in need of a medical detox. I've worked with patients who were on the severe end of the spectrum, where they would go to sleep at night and wake up after 4 or 5 hours of sleep and have to have a drink at the bedside because they would wake up with the shakes and a rapid pulse and severe anxiety and not be able to get back to sleep until they had a drink or 2 or 3. So if you're in that place, you might want to think about checking into a medical detox unit. If you tell yourself, gee, I'm not, my drinking's a problem, I'm not going to drink tomorrow. You promise yourself you're not going to drink tomorrow. And then tomorrow comes and you break the promise again for the umpteenth time. You probably are physically addicted and need to do a medical detox process. At the point of physical addiction to that drug, you're not going to be able to stop without some help to do it. But it is doable. Typically in the unit that I worked in, we had two processes, which was a 3-day process. And the medicine the doctors prescribed was Librium, but the 3-day process would typically work very well for drinkers who were on the moderate to maybe light end of the spectrum. For more severe cases, we would use a 5-day process where the medicine starts out at heavy doses every 6 hours. You dose, and then it slowly decreases. It's called a taper. And on the 3rd and 4th day, it'll decrease to 3 times a day. And on 5th day, it drops to twice a day, and then done. But it works very well, and it makes the process of coming off the alcohol humane and doable. And it makes it really a comfortable process. Sometimes they use Ativan in addition to Librium to help with if the withdrawal symptoms are not adequately relieved. There's additional Ativan that can be used to help with those withdrawal symptoms. And in people with liver impairment, liver disease, they use Ativan for those detox processes because Librium typically is harder on the liver. So if a person has a compromised liver, they will use the Ativan instead. The other thing to keep in mind about withdrawals to the point where a person needs a medical detox is at that level, the propensity for seizures is a realistic risk, and that's huge. It's a very big deal that you want to avoid. Why? Because if you have a seizure from withdrawals, very bad things can happen. People fracture bones, lacerations from falling down. You don't know exactly when you're going to have it in order to prepare to ensure that you don't hurt yourself. So the risk and the unpredictability of it is significant. So you want to avoid seizures at all costs. If you don't know where to go to do a medical detox, call your local hospital emergency room, and they will be able to tell you where you can go, especially if you don't have insurance. If you have insurance, call your insurance provider, and they will be able to tell you what medical facility you can go to get the treatment. I hope this helps. If anybody has any questions or comments about anything, leave a comment in the comments, and I'll be glad to answer. Thanks. I hope this helps somebody.